Hello, everybody. Thank you very much for joining. I'm just going to give it a moment as I know it takes a little while for people to filter through. I can see that numbers are changing, so I'm just going to wait a minute. But yeah, really nice to see you. Good morning, good afternoon, good evening, depending on where you're joining us from. And yeah, thank you so much for taking the time to be part of the session today. Okay, I think the number is staying. So yeah, I'll crack on. So yes, thank you very much and welcome to our session today. I'm Laura Davidson and I'm the recruitment manager for the Masters in Global Healthcare Leadership here at Oxford University. And today we're going to be hearing from some current students and alumni who are going to be sharing more about their experience since joining the programme. And they're going to be answering your questions today. So we'll move to full introductions very shortly, but I just want to say a massive thank you to the three of you for joining and being here today. Before we sort of get formally started as well, I just want to mention that this session is recorded. So the video will be shared sometime next week. For those of you that are joining live, you should hopefully see that the Q&A function is up and running. So please do post any questions that you have for the panel. We'll be keeping an eye on those and we'll do our best to answer as many of them as we can. At the end of the programme, I'll also briefly run through the application process for people who are still looking to make an application for the coming year. But to kick off, I will just start with a few key facts about the programme. So that's great. So the Masters in Global Healthcare Leadership is a relatively new programme. It launched in 2022, so we've had 3 cohorts so far. And importantly, it's a joint programme. So it's a partnership between 2 Oxford departments, the business school and another department called the Nuffield Department of Primary Care Health Sciences. And they bring a huge amount of experience and knowledge in really key areas to the programme like primary care, digital healthcare and health behaviour, whereas the business school, of course, have lots of experience in areas leadership, innovation and entrepreneurship. In terms of the structure, it's a 2-year part-time programme and it's broken down into 18 months of taught modules and then you have 6 months at the end working on a dissertation. There are 8 modules in total, and I'll go through those a little bit more in the next slide. 7 of those are in person, and it's designed really for people who, well, very much who are working full time. So the idea is that you gain the qualification without stopping work or having to move to Oxford. We have 1 intake starting every year, and as you can see here, the next intake starts right at the end of December, and the fee for the programme is just over £61,000. If we move to the next slide, please. Great. So just to share a little bit more information on the syllabus, the modules, the module dates. As you can see, the first module is 5 days, and then the remaining 6 in-person modules are 4 days. So they're Tuesday to Friday. We have 1 online module, which is module 8, which doesn't actually start at the end. So it runs concurrently over the course of the 2nd year in 5 blocks of learning, and we can always speak to the panel more about that. But the in-person modules, as you can see, they're sort of spaced about every 8 or 12 weeks apart. So it works out that you travel to Oxford every sort of couple of months, and the rest of the time you study at home and you return to your work. The time that you spend studying from home really sort of focuses on 3 key areas. First of all, sort of the pre-work ahead of each module, so the reading lists that faculty release. Then, of course, assessments that you have in the dissertation, and then the online module blocks as well. So that's sort of what the at-home work is mainly focused on. And in terms of the commitment of sort of how much time you need to make space outside of the modules, we say to people that it's about 10 hours of study time a week. So we can move to the next slide. Great. Just to share a little bit more, people are quite keen to hear about the sort of typical class profile and who are likely to be studying alongside. So we tend to see a class of about 35 students, so really nice size. And as you can see, the average age is 40, but there's a lot of range within this. So we have people who might be in their late 20s and early 30s, and then we have people in their 50s and 60s. And yeah, it's great sort of having this range and diversity within the classroom. Female representation is generally pretty good. Obviously, it changes year on year. I think in cohort 3, we actually have over 50% female representation, but generally it's sort of about 45%. And we also have, it's a really global cohort, so over 20 nationalities, and I'll go into a little bit more detail about that in the next slide. As you can see, it's quite an experienced group, sort of averaging again about 15 years of work experience. And there's lots of different sectors within healthcare. So we have a really nice mix of physicians, but you don't have to be a physician. We see lots of people working in different sides of healthcare, from sort of consulting, finance, technology, government, entrepreneurs. And again, that makes for really interesting discussion in the classroom. So if we move to the next slide. Great, so here we can see a little bit more about the international diversity of the class, which is using data taken from previous years and averages, and again, naturally every year is a little bit different. But as you can see, it's generally about sort of 20% or so from the UK, and then the rest is really spread across the globe, and we have every continent covered, which I think is, which is amazing. And importantly, we have a representation from both developed and emerging markets, which makes for sort of really rich discussions in sort of healthcare challenges. Great, so if we now move to the next slide, we will get into the main focus of the session today. So I'm really pleased to introduce our panel today. So here with me is Eva Fattorini, Edmund Obat, and Christina Lee. I will go around and ask them all to introduce themselves individually in just a moment, but in terms of where they are on the programme, Eva was a member of our first cohort 1, which started in 2022. So she has graduated and is an alumnus of the programme as of quite recently. Edmund joined cohort 2, so has completed all of the teaching modules and is working on his dissertation, which we were just speaking about, which is due in less than 2 months. And Christina joined the programme last September. So she's about halfway through and was in fact in Oxford just last week for her 5th module. So yeah, really nice to see you all, and thank you very much. So yeah, it would be great if we just started with brief introductions. So just hearing a little bit from each of you about, who you are, what you do, where you're based, about your background or whatever's helpful, and then we'll move into a few questions. So perhaps if we go in this order, if that's all right. So Eva, if we start with you. Thank you.
Hi, everyone. My name is Eva Fattorini. I'm a medical doctor. I'm trained dermatologist, board certified dermatologist. I live in Europe, and I kind of have a 360 view of healthcare, being patient, clinician, and medical administrator. And I guess I spent last 2 decades trying to bring more humanities in healthcare and address the gaps that are usually invisible unless you're a patient or family member. And I did it by integration of arts and creativity into the healthcare. And I worked for Cleveland Clinic, which is a global institution, for 12 years. I lived all around the world and practiced medicine and my administrative practice all around the world. And then I started my own consulting practice. That's about me. I guess we'll speak later about why I joined the program, correct?
Yeah, that's great. Thank you so much, Eva. Lots of brilliant experience. So yeah, thanks for talking about that. And Edmund, over to you.
Thank you, Laura. Hi, everyone. As you've heard, my name is Edmund Obat. I'm also a medical doctor and a public health specialist. Based in Nairobi, Kenya, and that's where I also work. My experience or my work has largely been in the development space, working in donor-funded public health programs, mainly in the HIV space in Kenya, largely, for the past 10 to 12 years. Spent around 3 years before that doing clinical work, primary healthcare work in government hospitals. And my work basically spans around public health programming, health system strengthening, policy and advocacy, and a bit of healthcare administrative work from public health space. Yeah, so that's where I am.
Fantastic. Thank you so much. That's great. And last but not least, Christina, over to you.
Thank you, Laura. My name is Christina Lee. I am a surgical oncologist currently based out of Portland, Oregon. As you can probably tell by my accent, I originate from this part of the world. I'm Canadian by origin, and my medical training has brought me through a couple of countries. So my training is based primarily in the US and Canada and in France. My role at the moment is 100% clinical, and my subspecialty area includes soft tissue cancers, primarily breast and skin cancers. And so my experiences have led me into different health systems over the past several years. I've been in practice now for about 13 to 14 years and independently now for 5 years. And similar to what Eva had mentioned, there are a lot of observations that we'll make as we move through practice that can naturally raise some questions about how healthcare is delivered and how patients can access care. And we'll talk a little bit about more in a little bit about how that's led me to this program. But I think,
Yeah.
yeah.
Perfect. Yeah, no, thank you so much. Thank you. I think, all of you have such amazing and strong experience. It's funny, actually, yeah, all of you are, I realize, medically trained, which obviously isn't something that everybody in the program is, but I think it's great that, yeah, you bring that variety of experience and sort of that clinical approach to the program. So, yeah, I guess leading on, just nice to hear a little bit from each of you about why you chose, to embark on this particular program and really invest 2 years in it. I won't go in the same order every time. So Edmund, should we kick off with you? Does that sound okay?
That's okay, Laura. Thank you.
Thanks.
Yeah, so for me, if I remember why I chose the program, it's because I was at a point in my career where I felt I needed growth in terms of leadership. How it happens in my country in terms of training is there's really no emphasis on leadership as a medical practitioner. It's kind of assumed that once you're a qualified doctor, you're a qualified clinician. It's you have innate skills in leadership, but having been in the practice, having been put in charge of people and programs, I knew I had my own shortfalls, and I wanted a program specifically tailored towards growing one in leadership. And I wanted a program sort of that had a blend between an MBA and an MPH. Having done public health, and I knew there was still a gap I needed. And so this program, when I read about it, the first time I came across it, I was just, this is what I need. And the other reason was what Laura explained earlier in terms of the way the program is delivered, because I felt I did not need to stop working to go for studies. So I wanted a program that had a hybrid, very flexible program, and the way I saw the modules were and looking at the modules, it kind of just spoke to me, and then that's why I chose the program. And then now, as I went through the program, I think one of the best things about it was the applicability of what I was learning as modules went on in my day-to-day work. So you'd come back from a module with new knowledge, new frameworks, new ideas, and for me, it kind of just fell in because I had the chance to start practicing and applying some of the things I was learning, getting feedback from the cohort, getting feedback from the faculty. So I did not wait to finish, to apply what I was learning. So that was the other good thing, yeah.
Great. So that blend of sort of academia and applied knowledge, and yeah. Lovely. Great sense. Great. Christina, shall I jump over to you?
Sure. So as Laura mentioned, I'm currently 10 months into the first year of the program, and I'm enjoying it tremendously. There are several reasons why I personally decided to pursue a master's. As a surgeon, I have completed quite a few years of training already, and as many of you can imagine, how much more schooling can a person possibly do? But the decision was quite intentional, and largely in part influenced by my experiences across borders, primarily in high-income countries, as I mentioned, US and Canada and France. But an interesting observation I made is irrespective of where you practice, and I made I guess I posed an interesting question to myself that some of the observations I made in conversation with clinicians all over the world, particularly at national conferences, is that we're all kind of under the same tensions, and we have some of the same conflicts in how we can deliver better care and access to care and create an improved experience for our patients, irrespective of their conditions. And so as a clinician, I felt I had a very privileged and unique lens in interacting with people at a very dire point in their life as an oncologist. That's typically the type of scenario that I find myself in. And although it's something that I encounter frequently, multiple times a day, it's always the patient's one experience, hopefully, just the one. And so naturally, it's really, I think, more common than providers acknowledge and have discussions amongst themselves. And how can we make this system more accommodating to each and every individual when there are healthcare disparities, when there is difficulty in access, when people don't have social supports. And as Eva was saying, I think humanity is a big aspect of medicine that I think as the field continues to evolve and become more technologically advanced, seeing now with all the possible modes of implementation with integrating AI into healthcare, we're moving a little bit further and further away from the basic tenet of what brought medicine into this world as a field to begin with. And so all of that to say, as a surgical oncologist, my role very much requires an integration with other subspecialists, primarily medical oncologists, radiation oncologists, palliative care, and pathologists and radiology. But that's all well and good, but it doesn't mean it always happens that way, even in the most well-funded countries. And so there's definitely a role for healthcare leadership. There's a role for integration and strategic leadership in organizations and also across health systems, regardless of the payer structure and the model. And this is primarily what this degree really helps you think about in a more granular and in a broad way as well. And it really allows you as an individual in whatever sector of healthcare you're in to make it work in your context. And that is what I felt was the biggest benefit in contrast to an MBA, in contrast to an MPH. And I'm so privileged to be part of a group of my classmates, really, who come with such a diverse set of experiences and roles, others who have MBAs and MPHs, and listening to how they contrast their experiences in those degrees and what the MGHL program adds to that. And I would say add instead of replace, because it's really on you as an adult learner to be able to look at all this new knowledge that you are exposed to and how to make that work in your healthcare setting. There is not one perfect answer, one perfect role coming out of this program. And that's really the beauty of this program specifically.
Lovely. Thank you so much. Really, yeah, lovely answer. So that's great. And yeah, Eva, over to you. Yeah.
Thank you for sharing, Edmund and Christina. So I really was thinking how to answer this question because, of course, now it's behind me. I've done the program, graduated, and I was able to, I said to myself, I'll tell you a story really, which explains it better. So there was an 8-year-old boy who was waiting for heart transplant for 27 weeks. And he was tied to the machines and his parents were desperate. He shut down emotionally, mentally. He couldn't communicate, and there was nothing that healthcare system was able to do. There are probably hundreds of thousands of children experiencing the same situation in the world. And Christina, you know, like a lot of kids with cancer, a lot of people on dialysis. And I thought, okay, what can be done? And there was one intervention that was very not high tech, but it was high touch intervention. And that was art therapy. It's a creative expression with board certified art therapists who came in and worked with a guy, and he opened up and was able to say the unsayable, was able to, you know, we were giving voice to voiceless. He opened up. It was something incredible. And I thought, how come I was not taught about this? I was underestimating the power of creative expression, call it arts. Is there something I can do to bring this to every hospital in the world, to create awareness? And why is it not there? So, everything in healthcare, as you know, is kind of intersection between administration and clinical practice. You can't move forward without having those two sides talk to each other. And I think during the modules, we actually had a debate about whether CEO of the hospital should be administrator or a clinician. So, looking backwards, what I was asking myself, I need to learn new language. I need to find out the way. I've been doing this for 17 years. I still was not successful in making it ubiquitous. So that meant to me, how do I change personally as a leader to make it work? How do I communicate to executive administration of multiple hospitals and organizational leadership to communicate this message? What type of system design or system innovation I need to learn about so this can be embedded in multiple systems? What type of evidence and research I need to evaluate and how, especially in this emerging field, to prove that this is actually working? What type of innovative tools I can develop? What type of funding can I find? Who can I engage? What type of enablers I need to have in the system? And then eventually, like, how do I write a policy brief about it? How do I talk to governments? How do I scale it globally? And I realized, again, going back, I learned all those steps of very important steps for my work, uh, how to make this work better in a language that I didn't understand before. So when I entered, I didn't know, but I had this lens through which I was observing everything, and it really, really helped me. And of course, it was Oxford, so I knew I'm going to learn from the best people in the world.
Yeah, no, that's lovely. Thank you so much for sharing that. And I think, I speak to a lot of people, and I mean, I think your story explains it so well. And lots of people's reasons for getting into healthcare in the first place come from so many sort of personal motivations and personal experience. And yeah, really lovely to hear more about that. And leads, I mean, you've all touched on this really, but I think a question that people are always keen to obviously hear about, the investment in terms of what impact a program like this has made on you, professionally, personally. And yeah, I know you've all already spoken about that, but I think it would be useful, yeah, just to hear a little bit more. And I don't know, maybe we should come back to you, Eva. You've obviously spoken about it, but as somebody who has finished the program, although sort of very recently finished and handed in your dissertation and graduated, you sort of have the longest perspective perhaps of time, and you can speak about your experience, or yeah, whatever you'd like to share.
It's a great question because, and I'm quite honest about it. I think the first thing it gave me more self-confidence as a person and as a professional, because sometimes you don't know, where you are in the field. It gave me clarity on multiple things. Of course, it connected me to fantastic group, cohort. And then also you become part of Oxford network at the broader scale. So I guess you can amplify your current knowledge by connecting to people, learning, challenging yourself. And I think what's also important, only when you know more, you just realize how much you don't know.
Mm-hmm.
And it was kind of very humbling experience because we all develop certain personas. I mean, all of us who are entering this program, we think, we know something, and you realize you don't know so much. And I think it keeps you moving forward. So it had a huge positive impact.
Great. And I know, yeah, cohort one, lots of amazing people, brave people who made a start on the program, being the sort of the first cohort. And it's lovely seeing, I saw people have gone into business together, within the cohort. There's been lots of lovely sort of changes and sort of yeah, new roles and all sorts as well. So
If I may just say, Laura, I mean, honestly, because you said it's behind me, only when you finish that, only when you're done and you're kind of, it's behind me, you realize, oh my God, that was really life-changing thing
yeah.
for us. Yeah.
You have the space to realize what you've been through.
Yeah, you have space to reflect. Right.
Thank you. Christina, over to you.
Thank you. So it's actually really reassuring to hear Eva's experience being in my first year. And as she was speaking, I was trying to think about my current experiences and also what I've heard echoed amongst my cohort members as we're moving through the first year. And it does feel like it's going quite quickly. We're 10 months in and 5 modules in out of 8, one of the modules being concurrent throughout the entire program. So a little saddened to know that there's only 2 more, there are only 2 more modules left. But when you're in it, I think a general sense that I've felt, as well as some of my other class members, is it opens additional questions as you go along, and how you might envision yourself using the program and integrating that into your career, or exploring career transitions. That's been a big theme within my cohort. And I've noticed in myself what my train of thought and my thinking, how that's evolved over the past 10 months as well. So much of it is molded by not only the content and the professors. You have new professors for every single module who bring a wealth of experience in their own fields as they share new knowledge with you. And it helps you glean kind of common scenarios that you might encounter in your everyday work life slightly differently. You might pose the same questions with a different lens, and I think that's incredibly important. And I've noticed in myself how I have conversations when I engage with my own hospital administrators, for example, because I'm in cancer care, and as I mentioned, it's a multidisciplinary practice. I'm often looking at integrated care pathways, not just in a hospital system, but also on a regional level. And understanding the small nuances of the barriers and challenges in regions is really informative, and how that has shaped the way I even look at the new course material, not only for past modules, but for future ones. So one of the things that you'll see when you start the program is each module content is released as you progress. So you're not overwhelmed, and you also don't really get to cheat and sneak peek ahead of time, which is quite nice, primarily because it gives you dedicated time to really think, even after your assignments are due, and even as you're moving through it, to really digest the information. And you'll notice, I think, as an adult learner, it's not simply knowledge consumption, assignment, and then you're done like a checkbox. I think the benefit is that it really allows you to be reflective and thoughtful about how you can think of past content or themes and frameworks, and how they're really interconnected. And our discussions in class, we see that. The comments within the cohort will often speak about modules preceding the current one and how those themes affect what we're talking about today. So I don't know what the program will hold definitively. I'm excited to, I guess, see how I'm going to feel after graduation, especially with the hurdle of the dissertation, as Eva mentioned, but it's all very optimistic.
No, that's great to hear. Exactly. You know, you're 10 months in, you've got a fair bit to go, but it's lovely to hear, and yeah, exactly how you're using it and how it's helped you. So thank you so much for sharing. And Edmund, hopefully you're there. Otherwise, we can come back and hear from you. You are fantastic.
Yes, I'm here.
Muted, but there. Oh, lovely. Yeah. Yeah, over to you.
Yeah, thanks. Yeah, maybe just because Eva and Christina really spoke to also what I was thinking.
Yes, of course.
And not to be so repetitive, but I think there's something Eva said that really was one of the first things that resonated with me, was the confidence you get from just I think by module 2. And for me, it came in the sense that from a problem-solving angle, you are very emboldened to say or look at a problem and say, leave that to me. I can work my way through it, and the systematic way of thinking that the program ingrains in you, that just grows on or at least it grew in me module by module, and so the confidence to tackle problems, of course, in the healthcare space generally, but also in life. I think that has been one very impactful aspect of the program. The second thing has been also, learning to unlearn, because we all came in, and I think it's one of the reasons why there's emphasis on experience, work experience. We all come in with our, lived and learned experiences by the time you're coming into the program. But one thing the program sort of teaches and taught me, and I know talking to my cohort mates, was the ability to pause and unlearn first, so that you're able to learn and sort of, build on what you know, or replace what you may think you knew, but maybe you knew it wrongly. And that was really, really impactful. The other thing is I think not talked about much enough is the networking, a bit of which the program enables, both within the cohort but also outside the cohort. And then some of the, the strongest links I would say I've built in the last 2 years have been through this program, both professionally and personally. Yeah.
Thank you. Thanks, Edmund. And yeah, I think really nice to hear common threads and themes that you've all spoken about, and the sort of the importance of reflecting and the confidence and the power of the cohort. So that's great. I will just ask another question, but I can see, I will just remind people joining the session, feel free, I can see they're starting to come in, but feel free to post your questions on the Q&A, so that we have time to answer them. And thank you for the questions that are coming in already. I will just ask one more question, which I feel is something that comes up regularly and people are always keen to hear, really, which is about how you experienced or how you found managing the program alongside all of your professional, personal responsibilities. Yeah, I think it's an important one. It's nice for people to hear. So whoever wants to jump in, we don't have to all answer, but yeah, if you have anything to speak about.
I'm happy to say something, and we can
Thank you.
because it's behind me.
Yes. Yeah.
I mean, look, it's not easy. It's not easy. Whether you work part-time, where do you do, but it's doable. I think maybe speaking to some of us, even after this session, I'm happy to do that. Would give some kind of practical advices, how you study, how you write assignments, how you what can facilitate that. It requires a discipline. It requires discipline of learning. It requires support. You need to have a support. If you have family, they need to understand what you're doing at your workspace. They need to so everybody comes from different circumstances. But obviously we all graduated from the cohort 1. It's doable, but I'll be quite frank, it is rigorous program. It's academically rigorous program. But every second invested is worth it. Yeah.
Yeah, great. No, thank you. I think that's really clear. Anything to add, or makes sense with you and applies?
I can speak to this a little bit because I actually engage my colleagues sometimes to ask them, how on earth did you get through this module? It's pre-reading sometimes. So I would second what Eva has mentioned. It is a rigorous program. It is demanding. And as adults, I have full confidence each and every one of you will figure it out, and everyone's an individual in that sense. But as a clinician, I am full-time. My patients are my first priority, and that's where my loyalty is. And it has remained as so, and I feel happy to say that I'm still able to maintain my practice in the same way. How I complete coursework is essentially evenings and weekends. This is not new to me per se, though. In surgery training, when you're working long hours, we still have academic responsibilities. So this is something that I've been a little bit familiar with over time, but not in a formal degree format. There are some modules that are more onerous than others in terms of preparatory work, as well as the assignments. So not knowing how you will look at each of the modules information, I think you just have to gauge a little bit of that. But I think, as Eva was mentioning, if you're disciplined about it, you will get through it all. And it may not be perfect all the time, each time, and that's okay. But when you're at Oxford during the intensives, that's a wonderful opportunity, no matter how well prepared you are, to really integrate yourself with the material, because you will learn even more when you expect you're fully prepared and you think you know all the material and you can contribute. There's always room to supplement that. And so I just think it's something to be flexible with yourself about, and just to give yourself a little bit of grace in that. But it is challenging.
Yes. I mean, Edmund, you're in the middle of your dissertation, obviously, so that's, a big piece of work, and arguably slightly more sort of responsibility on the individual to manage that over, the 6 months period. Maybe you can speak a little bit about, how you're finding it and support that you're getting, and how you're getting on.
Yeah. I think the key lesson for me and then for most of my cohort mates is that 6 months is a really short time. At the beginning, it seems far away, but as you go through the dissertation process, you do realize it's a short time. And then the lesson maybe I would want to pass on to those who will join the program, and even Christina and the cohort, is I think be very intentional about breaking down the tasks and sort of having your own timelines or deadlines. Because really no one really follows you around to ask you, have you done this? Have you done that? So it's you and the overall deadline. So just breaking down the tasks and having your small deadlines and meeting them. The support from the faculty is there. The support from the program management team and support team is there. You can always reach out. We have check-ins, I think, twice every month. Again, which are not mandatory, but so you find yourself breezing through, especially the first 3 months, if you're not intentional about getting the work done. And then, with life, there will always be challenges here and there outside the school. So if you really don't plan well, you may get into trouble there. And with the 8 or so modules, I think what Christina said is what I wanted to add is the intensive week. I found it to be very critical, especially if one is able to sort of immerse themselves fully during that week. You tend to take away a lot, but also gives you a very clear mindset on how you're going to move forward for the next 5 or so weeks with the assignment and before the next module. Yeah, and also intentionally trying to have some sort of break between the modules, because if you're not careful, you'll always be, on your toes. Especially if you leave the assignment too late, because as soon as the assignment is done, the next module opens up. So if you don't plan that time very well, you'll always be on your toes between the modules.
Yeah,
but it's manageable.
exactly.
It's all manageable. All of it is manageable. Yeah.
Thank you. No, thank you. That's useful to hear. I think, the rhythm of the program sort of been set in that way, but it is, it's certainly a commitment, but it's nice to hear more about it. So thank you. So, and I guess, so we're getting some questions in, and I will, read them out and throw them open to you. So anything that you're open to, that you feel like adding. So the first question from Sammy. Hi, Sammy. Thank you for joining. So he's asked, I'm currently involved in healthcare consultancy for hospitals. Can one or more of you elaborate on how the program might help managing hospitals more effectively? Do any of you have any comments on that, or anything that you think that you can help Sammy with that question? Eva.
Happy to chime in. It is my job now actually consulting the hospitals. As I mentioned before, first of all, you're going to have Oxford degree, which is going to give you a completely different entry point, because people will listen more carefully knowing what you've been through. I'm just being quite honest. And then if you follow all the modules, depends on what type of health consultancy you do, you can, I think, prepare better. You have toolkits that you can, maybe new toolkits that you can present to the hospital leadership. And then the third bit is you are a member connected to Oxford Network, and you will have cohort. And it's happening now in our cohort number 1. If you have something that you're not familiar with, or you need more data or something, you just push it through WhatsApp group, and your cohort is going to come back to you and they will help you. So that would be my answer.
No, that's great and very true. And I think also, I know that there's been various healthcare networks set up, because obviously you've got a really strong network within your cohort, but now we have 3, and it will be 4 cohorts of the program. And then we have lots of healthcare professionals on our executive MBA, our MBA, our diploma program. So there's been quite a few networks that have been set up within sort of the Oxford ecosystem. So yeah, lots and lots of support out there for you, which is great. We've got a nice question about colleges. Did your college at Oxford play any role in your experience of the program? You know, I know from speaking to lots of you over lunch and dinners, it really does, to very sort of as much as you want to get involved, it really does. But yeah, have any of you personally felt that you've done a lot with your college, or any stories that you can share that you know of, perhaps? Nice to hear about the college experience, which is, you know, a nice part of it.
I can
Christina,
chime in.
thank you. Yeah.
So I think the colleges was one of the biggest pluses and surprises. As a North American, I wasn't aware that this was actually an integrated part of the UK's university system. But essentially, when you enter the program, you'll have a choice of, I think, one of 38 or 39 colleges, and I'm a member of Somerville, and I've had the very privileged opportunity to connect with several people through my college, through the manager of essentially graduate programs. Because Oxford is such an integrated network, there's so many opportunities, even beyond the Nuffield and Saïd departments. I really, really encourage you to reach out to your administration and leadership in your own colleges, because there are so many alumni, there's so many people on campus who are members of your college or who have connections to other people, and just simply starting with a conversation about what your interests are and your motivations of doing the program in the first place. And what has been wonderful is knowing that you are a distance learner and you have a limited amount of time when you are at Oxford. If you ever have the time to add a few days before or after the intensive, or both, I would strongly, strongly encourage that. It allows you the breathing room to meet with these new connections, as your days during the intensive are quite involved. Every hour is nearly accounted for, and not just for your academic work, but also for social events, which is wonderful. But the college at Somerville, they've actually connected me with a few people with whom I am working on my dissertation. And so that has been very instrumental for me personally.
Fabulous. No, that's really nice to hear. And I know on a practical sort of level, quite a few people stay in their colleges, you know, so you can get the true Oxford experience, obviously depending on where you're staying. But I've had lots of yeah, nice stories of people, you know, staying and really making the most of being in their college all the time. So yeah, also something, yeah. I've had a question here. Oh, sorry, Eben, please go ahead.
No, just wanted to add also one resource from the colleges that the people need to be aware of and utilize is there's a college advisor assigned to every student by your college. And so this is sort of like a peer mentor who you can engage, you know, on issues academic, but also beyond academic. And colleges are different. I know a college in my cohort really stood out, and they had a lot of activities around the modules time. So we used to sort of get crash or join our colleagues from those colleges. And as Christina has mentioned, they're good forums for also networking and meeting other people beyond you know, the Saïd or Nuffield space. Yeah.
No, I think that's a really good point. It's something, yeah, I think college advisors can play a really key role. So thank you very much for sharing that with everybody. Had a question from somebody asking about scholarship opportunities within the program, which I think is yeah, you know, a common question that people have about applying. So every year there are scholarship opportunities through the university. We generally have a limited number of partial scholarships. We tend to have up to 50%. Yeah, limited number of up to 50% scholarships available. They're grouped into two categories. We have a women's award, and then we have a director's award, which is for men and women. We have sort of information available on our website about that. There's always a scholarship deadline. So the scholarship deadline for 2025 passed quite a few months ago. You had to apply in either round 1 or round 2 of the application process. So we'll reopen applications. I'll come on to that in a little bit, but we'll reopen applications for 2026 in October, I believe. So if you apply in one of the first couple of rounds, you can be considered for a scholarship. I will just say, you know, it's an important thing. All our scholarships are really competitive and you know, limited. There aren't any 100% scholarships. So you'll always be, you know, expected to pay 50% of the program fee. So, you know, you need to be exploring different avenues and aware of that. Just a sort of final question, I think, to finish, and a question that's come through. What advice would you give to someone who is, thinking about the program? You know, they're in your shoes at some stage of the process. Yeah, is there anything that you, want to share to people online? Eva, should I start with you, if that's okay?
Sure. Which question are we answering? Sorry, there are 4 questions. I was just reading them.
Oh, there's quite a few questions come through. There is, just any advice to people who are thinking about considering the program?
Okay, because I can see policy changes, reading lists, and so on. I can try to answer some of it.
Please, there's a question about how the program supports better understanding of healthcare policies. Yeah.
I mean, for me, it helped me a lot because I didn't know much about healthcare policies when I was, maybe Edmund would be a better person to answer that. It completely, basically teaches you how to write policy briefs. It's a new toolkit and it teaches you that very well. I think I can tie it to the reading materials. I think at the beginning of the program, it's very important to understand what type of what are you going to lose, Mendeley, or what type of storage for the research you're going to be given. Each module, it's happening on Canvas, is giving you reading materials, and you basically download it and you can keep it. So it's curated by professors or by lecturers, and then of course there is extended material that you can find yourself. So it's been curated for the particular modules, and that includes the policy brief. So it gives you the toolkit, it leads you to the sites, and then you go through that. And that's, I think, what answers the question. I hope so.
Yeah. Yeah, no, I think it really does. Thank you. And actually, so, while I was speaking, I saw that the questions were coming in. So there's a question as well from Anonymous asking about achieving or Commonwealth scholarships. No, I'm afraid neither of those do apply for this particular program. I know that Chevening's a 1-year full-time masters. Quite often it's 1-year full-time programs, and this is obviously a part-time program. There are a few scholarships offered by the university. Clarendon is one that does offer 100% scholarship. These are incredibly competitive. Nobody on the program has won one of these scholarships so far. That's not to say nobody ever will, but I just, I guess want to share that it's quite rare. But you can look at the university website for all the sort of the scholarships that you might get sort of picked up. To say that a university scholarship, which is different to one offered by the school, you get picked up automatically by the admissions sort of process. So there's not an additional step. You just have to make sure that you apply in the round 1 deadline. So that's just something to consider if you do want your hat to be in the ring for a scholarship. I'm just conscious of time. In terms of evidence-based practice, I'd be interested to know how you found your reading lists and access to research articles on the programme. Are there any examples of research or insights from your reading lists or in your wider reading of the programme that informed or changed your practice in some way? So yeah, a few questions in there, but yeah, how did you find your reading lists and access to, I mean, you have a wealth of access really at the university to different resources, but yeah, how did you find that? Christina, I can see you nod a little bit. Are you able to share anything?
Yeah, I can chime in quickly.
Yeah.
Module 4 was not so long ago for me, just having completed Module 5. So Module 4 is our evidence-based practice module. It's led by 2 wonderful professors and lecturers, so David Noonan and Kamal Matani, and they do such a wonderful job in presenting the content. And so you have to keep in mind, perhaps if you have a clinical background, this is not news for you, but the the reading list and the information and the way it's presented is done so well to allow anyone, irrespective of their background, to understand, integrate, and implement what's learned. So I'd have to say the reading is wonderful. There's a ton of extension reading for every single module. I'll have to say, as a clinician where our practice is evidence-based, that I thought it was still relevant and not too superficial, but also not too detailed to overwhelm anyone else. I'd say how it's interesting. After this module, I actually presented this to my individual group practice on a particular topic that we manage quite commonly in women's health. And it's what you learn, I think, as a clinician is that evidence-based practice is a wonderful and important approach to how you should integrate data into practice. But there are many barriers to why and whether it may not be executed the way it's taught. So has it changed? Have we gleaned insight from it? I think absolutely. But there are several human factors that you will also learn in the module as to why implementation of evidence-based research isn't necessarily as simple as it may appear. You have data that show certain outcomes, and in practice, it may not necessarily be that way in terms of care delivery. But I do want to add one more thing regarding the scholarships. Your college will have their individual scholarship opportunities too. So if that factors into your consideration of selecting a college, please look into that. And you could fairly easily find that on the college websites, but many more opportunities that way.
Great. No, thank you, Christina. Lots of really helpful information. And thanks, Edmund. I can see that you've answered a question live, so and typing, so really appreciate that. And yeah, just to finish before I just have a couple of slides, just any quick, any sort of closing remarks, really, any advice for people, anything that, just any final things that you'd like to share with people on the call who obviously are, well, I know we have a few office holders I've seen, but people who are hopefully going to join the program in future. Eva, should I start with you?
Yeah, thank you. Again, I'll be quite blunt about it. Look, it's not an easy program and nothing is perfect. There are always imperfections, but the fact that you're here at this call means that you are looking for some change in your life. And it's about being audacious enough to just dive in and just do it. I don't think there is a better place in the world, quite honestly, to do this. And if you enter with a growth mindset, you will learn for that. If you enter with the mindset, I'm going to blame somebody, I'm going to complain, you're not going to be happy with it, like everything in life. So I think from our experience, some people, a majority of people realized only later after we graduated how important and how great it was. So I think, again, being here, listening to this means that you are thinking about changing your life. And this is definitely a big change in a positive way that I'm very happy I did it. It was difficult. It was definitely challenging, but I'm very happy. And it took a while, honestly, until everything settled. You just realize, oh my God, we did it. So
yeah. No, that's great. Thank you very much. And Christina, I know you have to go soon. Any closing remarks? So don't worry if you need to drop off.
I would echo what Eva is saying. I think she has far more insight having completed the program, but I think if you even have a glimmer of doubt, that's actually a positive thing. You're asking yourself good questions, and very much the questioning you're doing is rather than it being a negative process, it's really positive. I think opportunity is what you present yourself and what you make of it. And I would strongly encourage you to dive in. I'd have to say in the beginning of the first 10 months, there were moments where I felt a little unsure about where this would go, but with time, I'm growing and developing much more clarity. And that's a part of the grace you have to give yourself in this growth process. So strongly second what Eva mentioned.
Exactly. No, that's great to hear. And something we speak about quite regularly. Yeah, is people's journey on this program is very personal. It's very different for everybody and sort of moving through that. Great to hear. So thank you. Yeah, we only have a couple of minutes. So if we can bring up just I think I only have 2 slides, which I will whiz through before we finish. So just to mention here a little bit about the admission requirements and application process. As I mentioned, you can still apply if you'd like to join us this September. We have a few final places available, but it will mean putting together an application quite soon. In terms of the requirement, we ask for you to have at least 5 years of relevant professional experience and hold a 2-1 or higher undergraduate degree or international equivalent. You don't have to have studied medicine, just a point to make. Lots of people in the program haven't. Also to mention that as obviously English language ability, the program is of course taught and assessed in English. You need to have a really strong command of English in order to be able to join and participate fully. So you can prove this either by doing sort of an IELTS or TOEFL type exam, or by providing a waiver. You can provide a waiver if you use English frequently in your role and have done for more than 2 years, or if you recently studied a degree and that degree was taught in English. So you just need to submit a waiver for that, and then you don't need to do a test. And then very briefly, just to mention, if you would like to move forward with an online application, what we need from you is an up-to-date CV. We need academic transcripts of every degree that you listed on your CV. So that's the breakdown of marks and modules for your degrees, not the final certificate. We need details of 2 referees. They'll be asked to provide a letter. And then there are 3 essays. 2 of them are 500 words, more sort of personal statements. And then 1 is an academic essay. The title is, "What do you think of the major challenges affecting global healthcare?" So this is an academic essay and a chance for you to sort of pull together a structured referenced essay. There is a second part of the application process, an important part. So if you sort of pass stage 1, the online application, you will then be invited to a short interview done for 30 minutes on Zoom. But if you have any questions relating to that, I appreciate that was quite a quick mention of the application process. I'm of course very happy to go through that. And just to mention, there is a £75 application fee, but if you come from a low-income country, there is no fee. So just to finish, next steps really, I really hope today has been helpful. And in terms of moving forward, you can request a meeting with me. I'm happy to answer any further questions. You see my contact details here. If you're not sure or would like feedback on your eligibility, please do submit a CV. You can do so on our website, or again, contacting me directly. And yeah, feel free to hop online and start your application, which is again is done via our website. But yeah, very happy to hear from people directly. And then yeah, just to finish by saying thank you, really massive thank you to the panel who've been amazing. Really appreciate you sharing your insights and coming on and being a part of the session today. I think it's lovely for everyone to hear your perspectives. And yeah, thank you so much to everybody for joining, and thank you for your questions. And we really hope to see you in Oxford in future. So yeah, thank you to everybody and enjoy the rest of your week. So yeah, take care. Thank you. Bye, everybody.
Thank you. Bye, everyone.
Thanks. Bye, Evan. Bye, Eva.